Assalamu alaikum dear doctors. In this video I am discussing about the common manifestations of congenital infections, and this information I have taken from RCPCH theory and science book case number 8. The child described in our case is unexpected small. Intrauterine growth restriction is a common consequence of congenital infection, and this should be considered as a possible cause. Many relatively common viral and bacterial infections have the potential to cross the placenta, leading to teratogenic effects. Varicella zoster virus, rubella virus, cytomegalovirus, and Toxoplasma gondii are the commonest seen in the UK, although congenital syphilis, once consigned to a footnote within textbooks, is beginning to occur more frequently. All these infections have the potential to cross the placenta during pregnancy and to cause congenital infection, more commonly following a primary infection. Now, rubella virus. Rubella, if acquired in the first trimester, congenital anomalies can occur in over 80% of fetuses. Maternal infection between 13 and 16 weeks leads to deafness in about a third. Infection beyond 18 weeks is of little risk to either mother or child. Congenital rubella presents as a progressive disease, and some abnormalities are not clinically evident at birth. Congenital rubella infection typically causes cardiac abnormalities like patent ductus arteriosus, which is most common and occur in about 30% of affected infant. Pulmonary artery stenosis and pulmonary arterial hypoplasia also occur. Eye involvement causes cataract, retinopathy, microphthalmia, and iris hypoplasia. Other manifestations include microcephaly, mental retardation, speech and language delay, and hearing loss. So, congenital rubella syndrome, they are telling that first trimester, remember, first trimester it affects 80% of the fetuses, and that is 13 and 16 weeks. And they are telling that between 18 weeks is the little risk of either mother and children. And congenital rubella actually causes cardiac abnormality, eye abnormality, cardiac abnormality mainly patent ductus arteriosus, and eye abnormality, that is cataract. One question come on the exam: if the infant is affected with this organism, the fetal life, then they have eye abnormality, cataract is developed. The answer is congenital rubella virus is responsible for that. Now, congenital varicella infection. Almost 15% of pregnant women are susceptible to varicella chickenpox. In most instances, the fetus is unaffected, but there are two at-risk periods. Maternal exposure to chickenpox in the first half of pregnancy leads to an approximately 2% risk of severe scarring of the skin, digital dysplasia, and occur or neurological damage. If a mother is infected with chickenpox shortly before delivery, then the fetus is unprotected by maternal antibodies and the viral dose can be very high. That leads to a very severe infection, and mortality in untreated babies is up to 30%. Though they are telling that if a congenital varicella infection occur in baby, then the infant is present with, after birth, severe scarring of the skin, digital dysplasia, and ocular or neurological damage. So, congenital varicella infection manifestation is severe scarring of the skin, digital dysplasia, that is limb abnormality occur, and neurological damage. These are present in congenital varicella infection. Now, congenital cytomegalovirus. Cytomegalovirus is the common congenital infection affecting up to 1 in 250 live births in the UK. Almost 50% of pregnant women are susceptible to cytomegalovirus, and in 1% of these will have a primary infection during pregnancy. In 40% of cases, the infant become infected. 90% of infected infants are normal at birth and develop normally. Of the 10% who develop sequel, then approximately half have features at birth: hepatosplenomegaly, petechiae, jaundice, growth restriction, and occasionally seizures, whilst half develop problem later in life. Many sensorineural hearing loss. So, about congenital cytomegalovirus, they are telling that this is the most common congenital infection in UK, and the features of the baby are like 90% infected infant are normal at birth, and the 10% develop features, and the features are like hepatosplenomegaly, petechiae, jaundice, growth restriction, and occasionally seizures, and half develop problem later in life, mainly sensorineural hearing loss. So, from this topic directly ask the question: diagnosed of cytomegalovirus, they tell the features on the question, and another question is come most commonly, that is sensorineural hearing loss. If the fetus is infected with the organism, which defect occur, that is sensorineural hearing loss occur in later life. Now, Toxoplasma gondii. Toxoplasma gondii infection is caused by a protozoa parasite. It can be acquired from consumption of raw or undigested meat, and from contact with the feces of recently infected cats. It is rare in the UK and affects only about 1 in 10,000 live births. Most infected infants are asymptomatic of the 10% that show clinical features. The most common are chorioretinitis, cerebral calcification and hydrocephalus. Asymptomatic infants remain at risk of developing later onset chorioretinitis. When a diagnosis is made, then prolonged treatment with pyrimethamine, sulfadiazine and folic acid is recommended. So if we tell shortly that congenital rubella virus affected persons has developed hearing loss, and there is heart defect, patent ductus arteriosus also present. Congenital varicella infection, babies are present with digital dysplasia, that is limb deformity, scarring of the skin and ocular or neurological damage. Cytomegalovirus, if develops sensory neural hearing loss later life, and the clinical features most are asymptomatic, some are symptomatic. They present with hepatosplenomegaly, petechiae, jaundice, growth restriction and occasionally seizures. And in case of Toxoplasma gondii, that is transferred, it is a protozoan parasite and it can be transferred by consumption of raw or undercooked meat and from contact with the feces of recently infected cats. And it causes chorioretinitis, cerebral calcification and hydrocephalus. Remember, congenital Toxoplasma gondii causes chorioretinitis, cerebral calcification and hydrocephalus. Hydrocephalus is present in Toxoplasma gondii infection. Please do subscribe and share my channel everyone. Thank you.